think the main difference, in my opinion, between us and others, that's something that may set us apart, is we started from square one and asked one question, and that is, how can we provide a patient with the best amount of support that we can give them and the best chance of success that we can give them without doing it in such a way that is overly onerous and overly expensive. In addition, there are several aspects to the workup pursuant to weight loss surgery which insurance carriers may require and have always been done in that manner just because insurance requires them. And it really hasn't been done in a way to help the patient. For example, many insurance carriers require you as a patient to see a psychiatrist or psychologist as part of the workup. Well, what we get from that as a provider often is a letter that says that you're competent for surgery. Well, that really doesn't help. It doesn't help you and it doesn't help us. All it does is fill a little checkbox at an insurance carrier somewhere that you've done that. What we try to design, rather than a list of check boxes that you try to accomplish to get your surgery, we try to create a program. In that regard, we have a full-time psychologist that has developed a whole psychosocial support program. Because although we know that not everybody that pursues weight loss surgery needs to have a treatment by a psychiatrist, and frankly I think that's a little offensive, there is no question that our psyche is very related to our eating habits and our lifestyle in America. And there are certain changes that are going to occur in the next several months that are very profound, and you very well may need some support through that. So that's what we're trying to provide. Another example would be our exercise program. Many programs do one of two things. They say, well, here, buy a membership to our gym and pay for our trainer and we'll teach you how to exercise. Or they say the opposite, the other end of the spectrum is, why don't you go exercise and make sure you do that, and give you no support whatsoever. What we've done is we've tried to combine those two such that we have an exercise physiologist that will develop for you a customized program that you can follow. And whether you live in Gallipolis or whether you live in Columbus or whether you live in Mansfield or whether you live in Lancaster, is something that you can follow and you can progress with without being local.